Good morning, everybody, and happy Friday. We made it to Friday again this week. And we're going to talk about something today that I think a lot of you have really mentioned a lot of times in our comment section that we've gotten a lot of emails about, and that is about the concept of herd immunity. Now, our own reporter, Sarah Weitz-Kodishek, wrote an article that published this morning about herd immunity, and she wrote about exactly what that theory is and what several different experts believe about that theory and believe about just that concept. So we have a lot to talk about today. I'm sure y'all have plenty of questions. If you do, leave them in the comments. I will be checking them out and I will ask Sarah as appropriate. So we've got a lot to cover today, especially this has been a topic that has been in the news recently and a topic that I think a lot of people are starting to discuss a little bit more as we have been in this coronavirus world for several months now. We are all getting the COVID fatigue, as somebody put it the other day. And this herd immunity theory is something that people sometimes cling to. Sarah, that's at least what it seems like. What did you find in your reporting about people and their initial thoughts on herd immunity?
Yeah, so if you think about a chain of transmission, say you and I are together at a party, there's several other people. If the majority of those people have already had this disease and therefore can't give it to me or you, we're much less likely to get it. So the idea of herd immunity is to get to the point where that chain of transmission slows and eventually stops.
So there are two, I think it was really important that you noted this at the very beginning of your article, that there are two ways to get to herd immunity, essentially, and that's according to these different experts. And the first way, or one way rather, is a vaccine. And the second way is just for people to get out and get infected and essentially mass infections. Is that correct?
Yeah.
So let's break this down and let's talk first about the theory about this mass infections. Let's just let people go out, get infected, and then they'll be immune and have antibodies and not be able to pass it along. What did these experts that you talked to, what did they think about that theory?
Yeah, and that's a theory or a popular conception of what herd immunity means that I, in the course of my reporting, and we at AL.com have heard discussed a lot in the last few months. What happens if we all go out and get this? We get stronger. There's several problems with that, experts are telling me. The first is that, it would probably lead to tens of thousands of unnecessary deaths, and also all of the other health repercussions for coronavirus. Permanent lung damage, brain damage, all of the things we're learning about. The other is that it seems like it might not work. And that we know that now because just this week, a study came out looking at various countries that have had widespread outbreaks and looking at the general population and then more specific populations where those outbreaks occurred. What is their level of immunity now? The studies are from Spain, from Wuhan, from Sweden, where the country engaged in an experiment. Let's all go out, from the beginning, go to bars, engage in normal life. In all those places, the level of immunity in the population is less than 10%. In Wuhan, it's 4%, and that is at the center of the outbreak. In Spain, it's 5 to 10%. So really, herd immunity is not happening. And then there's the question of why.
That was the question that I was going to ask you is, say in these places where there have been large outbreaks and that percentage of the immunity is less than 10%. Why is that? And is that a reflection of people maybe not getting accurate results from antibody testing? Is that something to where we just don't know enough yet about the virus to be able to determine, or what brought in that reporting and not reporting, but what went into that research?
I mean, we've all been living through this situation where what we know about the virus is changing and evolving, and it's confusing, but we don't know for sure whether there is such a thing as immunity. We don't know how long immunity lasts. Actually, there's some data showing that people are getting this again, that immunity might be short-lived. And you have leading scientists, including Dr. Fauci, pointing to those questions. So we don't know why immunity isn't widespread, but we're starting to see that immunity for this virus might not be as straightforward as we had hoped, and that likely, it could very well be temporary or much more difficult to achieve than we had hoped.
One of our commenters said that this is nothing new, and I'm going to disagree with you. And this is why I disagree with you, Dennis. And that's because every day it seems like there is something new, and that's the problem. Almost is that this research is ever evolving, and people are learning new things every day. So that's the thing that I think a lot of people struggle with, is that there are so many unknowns about this disease. And you're right, it's nothing new that there are unknowns, but that is something that's changing every day. This is an interesting question I'm going to put up on the screen, and this is from Jen. And Jen asks, what about the reinfections that are occurring? Sarah, do you have any or have you seen any data on those reinfections?
I know that there have been instances of reinfections occurring. I think that is still one of those open-ended questions that scientists are considering. I just want to bring us back also to this question you asked about what's at stake. Scientists estimate that right now, the death rate for this virus is about 1%. So if we have about 5 million people in Alabama, we're talking about 50,000 lives. If we all just went out and got this right now, we have never seen anything like that in this country. So it's really hard to conceive of, what that would look like.
And just looking at some notes I took from your story this morning, and there was a comment from one of the experts you talked to that said to reach this herd immunity, and whether that is from mass infections, from vaccine, anything that makes people at least to some degree immune to the virus, that 60 to 70% of the population would need to be immune in one way or another from the virus to achieve that level. Now, we've heard a lot, though, from people who say, look, even when there is a coronavirus vaccine, I'm not going to take it. We've heard a lot of that from people. So is that 60 to 70% marker, is that even reasonable, or do experts think that's reasonable even when a vaccine comes out, that we will get to that point?
Yes. So the experts I spoke with from around the country and in Alabama, their hope right now is that we get the vaccine, and that the vaccine provides us with some degree of immunity. So herd immunity is a concept that is a public health idea, and it came out of the context of talking about diseases where there is a vaccine. So if everyone is able to be vaccinated by an effective vaccine, and we don't know if a vaccine would for sure be effective, if 60 to 70% of the population was vaccinated, then we would technically achieve herd immunity. Some of the questions now are about 50% of people in surveys say that they won't take a vaccine. So for that reason alone, we couldn't achieve 60 to 70%. If the immunity is short-lived, even through a vaccine, we might need to revaccinate, sort of like the flu, we vaccinate every year. And so then there's, questions about distribution and access and cost of the vaccines and who gets priority. And governments would need to make a plan, and they'd need to think about, are we going to give this to healthcare workers first? Are we going to give this to the most vulnerable first? And then how do we ensure that everybody gets that vaccine that's willing to take it? So those are some of the complications about herd immunity through vaccination, which again is the best hope of these experts that I've talked to.
Right. We have one person saying that he thinks that 20% is effective for a herd immunity threshold. That's not, our expert said between 60 and 70. I'm not good at math. I don't know what to tell you there, but she did quote some people at saying 60 to 70%. Now, just looking through some of your comments, there was a comment about schools, about Krista, saying she refuses to put her kids back in school because of she has a child with severe asthma and is at high risk. I think a lot of people are in the same boat, Chris. So we can talk about schools later. But I think that you are not alone in that. I think a lot of parents are dealing with that same issue and that same dilemma that you have. Now, going back to some of this herd immunity theory, this is something that we've heard a lot in the news lately. Even just the other day, Alabama Senate President Pro Tem, Del Marsh, made a comment about, I want more Alabamians to get infected because then we will achieve that herd immunity. But then we go back to people like Krista who say that they have children, or maybe people have loved ones that have, or even themselves have a high risk to this virus. They could easily see themselves getting very sick or dying of this virus because of pre-existing conditions or because of other reasons. What do the experts say when people in power, such as Del Marsh and others, encourage that herd immunity by mass infection theory?
So this is a bioethical concern, is what they say, because when we have marginalized populations, particularly along racial lines, taking on the brunt of the effects of this virus, dying at higher rates, somebody is going to pay the cost of that herd immunity, and it's going to be those people more so. And then you have vulnerable people with COPD who are already on oxygen, or people with diabetes. And it's one thing as a healthy person to say, well, I want to go get immunity. And then, if you're the person who has that chronic disease, that's a completely different proposition. And when we have, the possibility of our hospitals becoming overwhelmed by this disease, which we're not there yet, but they're, we were at 80% of ICU beds a couple of weeks ago, and our case numbers are growing double daily rate yesterday for the first time. So then there's the issue of how do we make decisions about who gets those hospital beds when we don't have enough? And what if somebody's in a car accident, or what if they have a heart attack and they go to the hospital that has the technology that they need and it's full? So herd immunity is not the same kind of risk for everyone. And I think that's the kind of big picture idea that these health experts want us all to think about.
Something that I think was interesting that you pointed out was that from these experts, they say the most vulnerable people will bear the brunt of the herd immunity theory. And that is people often who are unhealthy, poor, and live in poorer areas. And can you talk about that again a little bit? Just the amount of people who would bear the brunt of that theory, that if everybody just went out and got infected, became immune, which we don't know if that is the case, how long immunity lasts, et cetera. But the amount of people, like you said, who would bear the brunt of that decision.
We have some communities in our state that have gone the majority of their lives without health care, and that has had a real repercussion for their health now. And if you look at nationally, data showing that African Americans are dying from this, I believe, double the rate of white people. So that's one example. In the Latino community, the rate of testing positive is 9% compared to, it's about double the rate of the Caucasian population. So the disease is spreading more widely in communities where people live in housing situations with many family members, go to jobs where they might work in food service or in a factory where they are more likely to get the disease. There's a very complicated range of reasons that some people are more exposed, and then they're more vulnerable when they get it because they have these pre-existing conditions like diabetes, chronic conditions that make it harder to survive. So I think that is the real concern there. And I want to make sure we're clear that this is for this idea of herd immunity that happens the natural course, like we just all go get this right now. Again, experts say that won't work, and that is going to cause this loss of life that will be disproportionately affecting already disadvantaged communities.
And there was at least one expert that you interviewed that called this natural herd immunity theory a quote selfish approach. Excuse me. Do you know who that was, and exactly anything else that they could say about how they believed that theory was selfish?
So that was Dr. Pamela Foster, who's a UA professor and epidemiologist. So she was talking specifically about this hypothetical scenario of, I have COPD and you're an athlete and have no disease, and you're 25 and I'm 65. Herd immunity for you to go out and say, let's all go get herd immunity. That's really different for you than it is for me. Or if you're the doctor who's deciding having to make this moral calculus of, do I take this person off a ventilator, or do I take this person? And that's what they had to do in Italy. And we're not at that point yet, thankfully, in Alabama. But that's the concern, that we want to slow what they have been telling us all along, is we want to slow the spread so that we don't get to that point of overwhelming the hospitals and making it harder for those of us who need care for any reason to get it. And I just want to make another point out something, that even though herd immunity through a vaccine may not be possible in a strict sense or easy, the further we get towards that herd immunity, that is the better. So it's not like an all or nothing proposition, but that is the safe way to get it, I guess, or perhaps the only way.
That's a good point to make. Something I wanted to pull up, and this is from William. He says there's a recent report that the low lifetime, which is only months, of antibodies may mean that herd immunity may not be attainable. You had some quotes from some research in your report about that. Can you explain a little bit about this, or rather what we do and what we don't know about the lifetime of coronavirus antibodies?
There is growing evidence that immunity may be temporary, may be short-lived. And as far as antibodies, the reports this week show again that very low levels of antibodies are remaining in populations that have had widespread outbreaks of the disease. And that may be a reason why.
Very interesting. Again, that's one of those things I think we don't know a lot about. And we've only been in this several months now. And our brilliant doctors and scientists and everybody are still trying to research and still trying to learn things. Look at Mary Maxine talking about how she has a child with Down syndrome who does not like to wear his mask and likes to put his hands in his mouth. My heart goes out to you, Mary Maxine. I'm sure that is extremely difficult I think it's difficult for everybody at this point to wear their mask. And so our heart goes out to you. And same with Krista talking about your children having severe asthma and allergic reactions. Our heart goes out to you and wish you the best of luck and safety as well. Sarah, there are some people who want to say that this whole theory about vaccines versus mass infections, either ways to get immunity, is political, and it is all based in that political fact. And I just wanted you to explain a little bit about where some of your research came from and those places where you got your data from.
Yeah, so the Lancet Medical Journal is the journal that published the studies about the worldwide data on immunity that has been achieved in these various countries. The scientists I spoke with are from University of Alabama, UAB, Johns Hopkins in Baltimore, Harvard, and then the University of Georgia. So a real widespread sampling of medical professionals from around the country who have been studying these questions very carefully.
Got it. Thank you, Sarah. Now, looking too at some of y'all's comments, I know you have a lot of questions on schools. Allison, I see you talking about schools and childcares. We're hoping to get some more news about those reopening plans in the next week or so, but I will try to get somebody on here maybe next week to talk about schools reopening and the different plans with that. So stay tuned. Allison, Krista, several of you asking. I will get that for you. Just give me a few days. And thank you so much. You got a fan here, Sarah, who remembers listening to you when you were on the radio in Little Rock. So, David, I'm sure she is very thankful that you are back. So thank you so much, Sarah. Thank you to all of you who are watching today and who are reading our journalism on AL.com. We greatly appreciate you. Thank you, Sarah, for taking the time to explain a little bit about this and explain a little bit more about a topic that everybody's hearing and maybe not quite fully understanding.
Yeah, I hope that's helpful. I have learned a lot about this myself, and I think it's really interesting. So thank you, Yvonne. I appreciate the chance to speak with you.
Absolutely. Thank you, Sarah. And everybody, thank you so much for watching. We will see you on Monday.